We're talking about the anxiety disorders over here that basically includes the psychiatric condition in which the person suffers from extreme fear and extreme worries. And all of these worries and fears are going to inculcate in his functionality of the normal day-to-day life. And he's going to come up to you saying that he's suffering from this extreme fear. And along with this fear, he's having the physical symptoms as well. For example, he'll give you the history of palpitations, he'll give you the history of sweating, and all of these is going to basically affect this tachycardia, palpitations, these tremors are going to affect the functionality in a particular individual. So we have a lot of variants to these anxiety disorders. Sometimes these anxiety disorders are related to some kind of an external stimuli. For example, the agoraphobias, which is basically an anxiety disorder, a panic attack that arises after a person is in a closed space. Whenever we are referring to a closed space, it's basically any small space. It can be a small room, it can be an elevator. So these persons usually get panicked by getting into this small closed space stimuli. So this is one of the variants. And over here in this section, we'll be focusing upon the panic disorders primarily. So how do you define the panic disorders? We'll be getting the knowledge to that. We'll know how do you diagnose a case of these panic disorders, how can you treat or intervene with these panic disorders, what are the different assessment criteria for these panic disorders. Sometimes you regard them as mild, moderate, or sometimes they can be regarded as the extreme kind of panic disorders over here. So in this section, we are going to primarily focus upon when a patient comes up to you in an outpatient department and you get to know that patient. He gives you the history of these palpitations, these tremors, and sometimes these panic attacks. He's in a state of a mini manic episode. So this panic attack is sometimes observed in an individuals in quite normal condition. Usually it is quite explainable in a lot of individuals, but if it is not explainable and sometimes the sign and symptoms are quite uncontrollable and the person basically suffers a lot of distress due to the sign and symptoms, then only it is regarded as a pathological condition. And when you have diagnosed a case of panic disorder, how can you manage such a case? So basically, as we've been already focusing upon the facts that any psychiatric disorder, when you start managing, it's basically the start of the history. You get to make a rapport with the patient and only then he'll give you the minute and the complete details of his ailment that is towards his psychiatric condition. Upon digging on the history of such an individual, you get to know sometimes that the person was already borderline and a lot of external stimuli, or it can be any incident from his past that is provoking these panic disorders. So history taking is again the mainstream, the main line over here whenever we are talking about any psychiatric condition, especially the anxiety disorders or particularly the panic disorders. So the assessments and the treatment lines is again very important. You have to assess whether the patient is suffering from a mild, a moderate, or a severe form of a particular panic disorder. Defining panic disorders, it can be the recurrent attacks of panic, and the symptoms, they usually include the escalating subjective tension. So this is the primary symptom observed in a particular individual. Starting off with sweating and chills, this is how the patient would describe his conditions, that he starts to sweat and he has that chilly feeling. The chest pain or discomfort, also regarded by the clinicians as the retrosternal constriction, in which the person suffers from discomfort in the retrosternal region, a difficulty in swallowing, a difficulty in breathing. All of these will be observed along with this chest pain. Palpitations will be observed along with tachycardia, tremors along with nausea, vomiting. All of these signs are basically the primary signs of panic attack. There'll be butterflies in the stomach. Usually, these butterflies in the stomach are due to something wrong is about to happen. This is what an anxious person would feel all the time, being apparent about the future. So this is the pessimistic thoughts that he'd usually go about. There'd be dizziness or the fainting feeling would be observed in such individuals. The extreme kind of dread or fear of loss of control or dying. So all of these will be observed in this particular individual as well. And then there is depersonalization or re-realization. So these are the phenomena that the person would get unattached to the surroundings or to the realistic environment that he is in, and he'd go into a fantasy state. Basically, it would be some kind of a pessimistic thought that would indulge in this depersonalization as well. Paresthesias, feelings of pins or needles, these hallucinations, these tactile hallucinations would be observed in these panic disorders as well. Now, when we talk about the diagnosis in this particular kind of case, it's basically the illness course, varying severity will be observed in these particular individuals as well. Now, the onset usually is in adolescence, that is usually in the teenage life or in the mid-30s as well. The increased incidence of the mitral valve prolapse would be observed in such individuals. 30 to 50% along with this mitral valve prolapse would be present in these particular individuals. The assessment and treatment is again very important over here. How can you assess a patient if he's suffering from a milder form, from a moderate, or from a severe form of these panic attacks? And then the medical interventions. Obviously, we'd refer to the reassurance and we'd refer to the counseling sessions whenever we are dealing with the psychiatric ailments. But of course, if these don't work in a particular individual, we'd go to the medical interventions or the pharmacological therapies as well. It's usually secondary to depression. So sometimes it's the depression and the panic attacks comorbidly present in a particular individual at the same time. One should exclude epilepsy and intoxication in such individuals as well. It can be with or with withdrawal from the drugs or alcohol. Assessment is same as for the CAD. You get the history, you assess the patient for the severity of the symptoms, and then the combined pharmacological or the psychological treatment along with the CBTs, that is the cognitive behavioral therapy, is sometimes considered in these individuals. Then the serotonin reuptake inhibitors or the antidepressants is sometimes prescribed. For example, buspirone is sometimes prescribed in certain kind of individuals. And the tricyclic antidepressants can also be a drug of choice in these panic attack disorders. They are fast-acting benzodiazepines, for example, alprazolam. A better strategy would be to ask the patient to rebreathe their own air in such cases of panic attack by simple expedient of breathing into a paper bag. They would breathe into that paper bag. So that will basically release that panic attack in the particular individual, focusing on emptying lungs on expiration. So when you'd ask the patient to breathe into that air bag, you would ask him to concentrate on that expiration, and he should basically focus on the complete emptying of the lungs. So this is sometimes a strategy that is used even by the air crews or the cabin crews in the aircraft when a person suffers from such kind of panic disorders. The cognitive behavioral therapy is an exposure therapy. It's a relaxation technique, and it's kind of a self-help that is sometimes given to these individuals. So in this section, basically, we focused upon the panic attacks. That is a variant, that is a very common variant of the anxiety disorders. So that is the end of this section. Thank you for watching sqadia.com.